Welcome to a new episode of Noi Parenting. Today we will discuss about head injuries in children. Injury to the head is one of the common injuries. Children, being themselves, get injured quite often, and when it's a head injury, the parents get worried. Fortunately, head injury may not always be dangerous. The prognosis of the head injury largely depends on the method of injury and the clinical presentation of the child. How do head injuries occur? Head injury may occur during sports, during falls, road traffic accidents, and various other ways. What are the investigations? The investigation largely depends on the clinical condition of the child. It's extremely important the child has a detailed examination done to look for the functioning of the brain. X-rays may be asked if there is a facial injury and is suspecting fracture of the facial bones. CT is asked if you are suspecting serious injuries to the brain. Not all head injuries need CT scans. There are strict criteria as to when to get a CT head. Remember, if a CT scan is normal at this point, it does not mean that there won't be any worsening in the next few minutes or hours. Hence, the timing of the CT scan is extremely important. Now, the CT criteria, it includes the mechanism of head injury. Was it a low impact injury, or was it a high impact? Was it a road traffic accident, and so on? CT criteria also depends on the brain functioning, the level of consciousness, how the child behaves, and any alteration in their behavior. CT criteria can also include if you are suspecting fractures, which can be dangerous. It also depends on the age of the child and various other features. If the child does not fulfill the criteria for CT, then it is advised to observe the child longer and to get the CT done only when things change. What are the problems with CT head? CT is a lot of radiation, and each CT can be equivalent to getting a few hundred X-rays in that one time. Now, there are a lot of concerns of radiation that happens with CT to cause cancers. Hence, one should have firm reason to get a CT head done. Also, like we said, CT, which is normal at this moment, does not mean the CT will continue to be normal. Hence, get a CT done only when required. In the next episode, we'll talk more about the clinical presentation of head injury. Until then, take care. Thank you.